Depression is so many different things. It's not being able to enjoy a beautiful day. It's not being able to enjoy your work. It's feeling like crying when you don't know why you want to cry. Panic attacks, if you have difficulty breathing sometimes, if you're unable to have relationships. The thing about antidepressants is it doesn't change what you think. It doesn't change even what you feel. It just reduces the intensity of the feeling. The opposite of being depressed is being relatively well balanced. Life is about dilemma. Life is about feeling conflict inside yourself. It's the dilemma of the choices that you have to make, that you can't make, because if you do A, you can't do B, and if you do B, you can't do A. And if you can bear that, you're well balanced. If thoughts come into your mind that are depressing or worrying or upsetting, what we tend to do is rationalize why we should be thinking about those things. We can convince ourselves that we're right to be thinking, that we're right to think about them, because if we think about them enough, we can fix it. We can fix the past or we can fix the future. But we can't. So what I have to help people do is not obsess about their feelings, especially their negative feelings. You're trying to control your thoughts. You're trying to control how you think. So you introduce songs, or you introduce the future, or you try and control other people, or you try and be clever about the past and regret the past. And in fact, what you're doing all the time is regretting the past and worrying about the future and not able to be in the present. I know it's a bit cliched, but you're not able to be in the present because of fear of the future and regret about the past. And that's what leads to depression. Then you have to deal with what happens then. Not deal with what happens then now. Who knows how you'll feel then, if then ever comes, if that happens. What I'm trying to help people do is observe from above themselves without it having to be analysed, just to notice what they're doing, notice what they're feeling, be aware of it, understand and accept what they're feeling, and see whether they can make choices to do things differently through the techniques and the behavioural observations, as opposed to the intense internal dialogue and analysing that your problem, this is what you think you're doing to help yourself, is not helping you, because you're reading more and more and more books, thinking more and more and more about what you should be doing, as opposed to observing what you do and why you are the way you are. So the answer is to do this much more, to talk regularly, to get these things off your chest and get them into perspective. It will be better than it would have been otherwise, and it will give you some choices to deal with things in a different way from how you've dealt with them in the past, which has only reinforced the problem.